What is the number 3 killer in the United States in hospitals? Well, it is the hospital stay. According to the latest study, Western medicine in all of its advances, where people are flocking by the millions every week to get some kind of high-level medical care, 1 out of every 25 patients that will get the treatment will end up getting an infection. Those infections, according to the CDC's latest report, will cause 722,000 patients to be seriously ill and stay in a hospital. 75,000 of them, or 10%, will die. And yet, when was the last time there was a major effort to understand when you're weakened in your immune system and you go into any infected environment, there's a probability you're going to be infected. If you're strong in your immune system and you go into a weakened environment, you may be infected, but you're not going to die more often than not. Your body will recover because it's strong. So why not have a remedial course of what to do to prepare yourself for any form of hospitalization? It doesn't take long. You could do a class in under an hour, and that could help people have stronger immune systems no matter what they're faced with, and that could save lives. But do the hospitals take credit for being dispensers of major infections? They kill more Americans, hospitals do, of infection than anyone else dying in the United States in those numbers. Now, that's just hospital-borne infection. That's only one part of the story. An estimated 440,000 Americans are dying each year from preventable hospital errors, including injury, illness, and infection. And those are very sobering statistics. And then you have patients who die, but not because of doctor error, nurse error, orderly error, infections, but because of properly given medications. We over-medicate people. We give them medications to counter the effects of other medications, where in and of themselves, the logic is that if a person has high blood pressure, by giving this medication to lower the blood pressure, we don't look at, will it also damage the kidneys? Yes. Will it damage the liver? Yes. Will it impact liver enzymes? Yes. Will it possibly cause a heart attack? Yes. By giving people statins, does that destroy coenzyme Q10? Yes. By giving them a mini aspirin, can that thin the blood? Yes. Will that help prevent a stroke? Yes. But will that also destroy vitamin B6, folic acid, B12, and vitamin C that help prevent a heart attack? Yes. So on the one hand, we prevent a stroke and kill you by a heart attack with an elevated homocysteine. It's all perfectly logical. You will never be criticized for killing someone as long as you follow the protocol. Hence, the patient is irrelevant. The protocol is essential. We reward people for following protocols even if every single patient was to die. If every patient in America went to their doctor, and every single patient, no matter what, they went for a toothache, they went because you got a splinter in your finger, or you went because of abdominal surgery, if every single patient died, no doctor would be reprimanded, no system would be changed, because the logic is you're rewarded, the hospital would be rewarded, the anesthesiologists, the technicians, the suppliers of the scalpels, the suppliers of the saline bags, everybody is in line to be rewarded. So you cannot not reward people at the same time that you're condemning them for being part of the, hold on, why are you charging $30,000 for a single use of a single chemotherapy agent when the same agent in Egypt is only $800? Well, because we can charge that here in profit and non-profit hospitals. So everybody profits, except the patients. So when you add up how many patients die because of properly given medicines, but shouldn't have been given at all, then American medicine is the number one cause of death in the United States every year, more than heart attacks, strokes, cancer, and diabetes. And yet not a single thing will be written or spoken or done to change any of it. Because in America, we're unique in rewarding for effort and never considering results. Something just fundamentally stupid about that. To give you an idea, well, yesterday I mentioned that The official figure is 4,000 people dying every day in China. And a friend last night said, I heard your figure, Gary, and I think people would get a better idea of that if you put it in a context, like, say, something everyone in New York knows, for example, that we're heard worldwide, but everybody knows Madison Square Garden. It holds somewhere north of 25,000 there, more or less. Well, okay, that's exactly 5 days. Every 5 days, enough Chinese die of air pollution, just air pollution. We're not talking about water pollution now. That's a separate amount of deaths. We're not talking about a cancer due to the coal. We're just talking about air particulate. So you could fill every week of the year, not even every week, every 5 days, you could fill Madison Square Garden with dead bodies. So every seat is taken by a dead Chinese person with a little note that says, this week, everyone in these seats, all 25,000, this 5 days, died of air pollution. But how about this? Every 27 days, you could fill Madison Square Garden with a dead body of someone who got good medicine or the right medicine, but their body couldn't handle it. Hence, they were maltreated, or a medical error, or an infection they got from the hospital, or malnutrition they got from the hospital, or a doctor not properly sanitizing their hands before surgery, or, let's say, a dentist taking the headset and putting it on you, not realizing that headset had not been sanitized before someone before you did, and then touches your mouth. Now you end up with a massive infection. How many people are injured each day, not dead, injured each day in the United States? Okay, it's 10,000. Well, 10,000, the largest stadium that I'm aware of, there may be a larger one, is up University of Michigan. I believe it's 110,000 can sit in it. Just imagine this. Every 11 days, you could put a person injured by American medicine in every seat in the largest sports arena stadium in America. Every 11 days. And it never stops. So just be aware that when you believe that you have nothing to fear, there is nothing life-threatening or injurious that could happen by going into a hospital, think again. And also, what have I not included? Every person that is injured or dies at home from the medicine or medical procedure. So if you die in a hospital, it counts. If you die at home from the procedure or medicine you're taking from the hospital, it doesn't. It's on no one's records. Now, for those of you who have any of the problems like UCI, or some of the other conditions, there is one herb that really is good for pain, and that's willow bark. Willow bark is valued as an anti-inflammatory. The bark has been known to break the fever and reduce pain and inflammation. And other herbs and plants are valued because of their ability to improve overall health and general quality of life. One of the herbs that we do not pay attention enough in our society is rhodiola. Rhode, R-H-O-D, Iola, I-O-L-A, rhodiola, rosea, R-O-S-E-A. It's also called golden root, and it's been used in Ayurvedic medicine and other natural healing traditions in Asia for thousands of years. It's one of the best overall health tonics you can have. As a pick-me-upper, as an energy rebooster, is adaptogenic. It's a yellow-flowering alpine plant, and with one of the long histories of medicinal use. In fact, University of California, Irvine, the scientists were looking for the effects of the plant on the human body, and they found that by taking rhodiola, the active ingredients in rhodiola were able to act on the biological pathways that support better overall body functions and lengthening the lifespan. Now, this discovery is considered to be significant. Traditionally, the medical community has held that dietary restriction is one of the key components of lengthening lifespan, meaning caloric restriction, especially restriction of things like sodium and saturated fats. In fact, however, rhodiola worked even when those dietary restrictions were not in place. And then they found it actually lengthened lifespan. In this case, of fruit flies was one of the things they used to determine life expectancy. It improved the lifespan of fruit flies by 25%. So, rhodiola, for overall life expectancy, for better performance, for helping your body, it's just an overall great tonic. And finally, scientific evidence reveals the cancer-fighting power of beets. Absolutely. Now, when I went on the road this morning, I took my coconut water and my fresh organic beet juice with my supplements that you always should take before you go on a workout, like coenzyme Q10 and magnesium from citrate and your vitamin E from mixed tocopherols and vitamin C and cayenne, because that all helps your blood and helps prevent a heart attack or stroke. But also the nitric oxide that allows greater microcirculation to your brain. Therefore, beet juice would be great for people with poor neuropathy conditions or inflammation in the feet, poor circulation, little splotchy veins, spider veins, broken blood vessels, but also people who have dementia, memory loss, Alzheimer's, Parkinson. Beet juice, 2 glasses a day would be terrific for you. But now, according to Dr. Alexander Fernenzi at the Department of Internal Disease at the Cosmo Hungary University, they found that beets help fight cancer. And that's important. And this was in the Australian International Clinical Nutrition Review. In one study, for example, a 50-year-old man suffering from lung tumors, which corresponded clinically to lung cancer, was treated with beetroot. And in just 6 weeks, the tumor had disappeared. And after 4 months, the man gained back the weight loss that he had during his cancer. And his blood work results corresponded to clinical recovery. In another study, a prostate cancer sufferer and uterine cancer patient were both admitted to the hospital. At the time of admission, both weighed the same. The man with the prostate cancer received beetroot treatment, but the doctor noted that the uterine cancer patient could not take it. And although he had been bedridden with a catheter, when admitted, the man was able to have his catheter removed after a month and soon began walking around and putting back on weight. The female patient, however, continued to lose weight. After just 3 months, there was a weight difference of 23 pounds between the two. The fact that other iron-rich foods do not have the same effect could mean the benefits of beets, and something in the beets, possibly in its coloring, could be doing the work. Now, no one has isolated everything in the beet, but clearly something in that beet is a catalyst that helps the body, and it's terrific. So right now, since we do not have all the information on what it is in the beet, just the beets are good and good for you and good for longer and better athletic performance. I'm Gary Null. Let's take a break and come back. We have a lot more to share with you.